Okay, so I'm knocking the door and I'm introducing myself to the patient. Hello, my name is Jose. I'm gonna be your nurse today, Miss Sandra. Can I please confirm your full name and date of birth? Thank you. While the patient is confirming the full name and date of birth, I'm washing my hands. And then I'm gonna be checking also the same information that she's giving me with the band on her wrist. So patient is confirmed. So Miss Sandra, I would like to explain to you what I'm gonna be doing today. I'm gonna be doing your postpartum assessment. So this will consist of me doing a physical examination on you from so I'll be checking your breast, your abdomen, your uterus,
Lower it.
your private parts, and also in the back, and then your legs as well. So I'm gonna be putting some gloves in order for me to do this. Are you okay with me doing this? Perfect. Okay. So I'm gonna raise the bed just for me to be more comfortable. And I would like to let you know that the patient tech took your vitals no long ago, about 10 minutes ago, and we have your blood pressure as 120/80. Your respirations are 14 respirations per minute. Your heart rate is 80 beats per minute. Your oxygen level is 98%. And your temperature is 98 Fahrenheit degrees, which all of your vital signs are normal, which is a good sign, okay? I would like to know if you have any pain today. No pain at all? Perfect. All right, since the patient has no pain, then I'm gonna proceed now starting the postpartum assessment. So I'm gonna start with auscultation. So I'm gonna have the patient sitting up a little bit. Okay, Miss Sandra?
I say that for you, but what else? Oh, okay.
And the first thing that I'm going to be checking is my apical pulse, which is in the mid-clavicular line, 5th intercostal space. And I'm going to be listening for a full minute. So after listening for a full minute, I get 80 beats per minute and no abnormalities with the heart sounds. Now I'm gonna be listening to the lungs, and I'm gonna start on the right side. Take a deep breath. Breathe out. Take a deep breath. Breathe out. Take a deep breath. In and out. Take a deep breath in and out. Take a deep breath in and out. Take a deep breath in and out. Perfect. So I did not listen to any abnormal lung sounds, which is a good thing. Passing air, normal, nothing to be worried about. So now I'm gonna be uncovering your abdomen a little bit because I need to listen to your abdomen.
That's why you see me reach for the best.
I'm gonna start on the right lower quadrant, and I'm gonna be checking for vowel sounds. Vowel sound present.
That's why I went like this. I'm like, wait, I think you could do it here.
Vowel sound present. Vowel sound present. And vowel sound present. Perfect. Okay, Miss Sandra, I'm gonna listen to your lungs in the back once I have to check the back part of your body. Okay. So if you don't mind, I need to uncover your breast, and I would like to know: do you feel them soft, feeling hard? Do you feel them soft? Okay. Perfect. Any pain at all in there? No? Alright. If you don't mind, I just need to palpate a little bit. So both breasts feel soft. And I'm checking also the nipples. I don't see any cracks. I don't see any lacerations. I don't see any dryness, which is good. And I don't see any redness as well. Same with the skin here. No redness, no any abnormal coloration. And the skin is warm to the touch. Alright, thank you so much, Miss Sandra, for that. Now I'm gonna be checking your I need to feel with my hands the fundus of your uterus, which should be located here in your abdomen part, okay? You just please let me know if you feel any pain. So with my left hand here firm, I feel the fundus. Alright, so I'm feeling the fundus of the uterus. It's located 1 centimeter under the umbilical, centralized, medial, which is good. That's where we want to have it. And since I'm checking here, I'm gonna see if I see any distended abdomen, which I don't. And now, Miss Sandra, I need to ask, have you been able to evacuate? Have you had any bowel movement in the past 24 hours? Yes, you did last night. Okay, perfect. And have you been passing any gas? Okay, perfect, yes. You have. All right. So now I need to ask you about your urination. Have you been able to urinate normally? Any pain, any burning, any weird sensation when you're urinating? Not at all? Okay, perfect. All right. So now I'm going to be checking here your lochia. Have you been seeing that you're bleeding more than normally? Have you had any abnormal odor? Regular odor like in your menstruation? Okay. So I'm gonna be checking the pad. So the pad, I'm seeing a pink bleeding, which is called acerosa, and is suspected on her conditions since she is 48 hours postpartum. Okay? And I don't see any lacerations, I don't see any episiotomy here, so that is a good sign as well. All right, so now I'm gonna be calling my patient tech to be on the other side of the bed because I need to move Miss Sandra to that side. She's my patient, my nurse tech is gonna be holding the patient for me. So 1, 2, and 3. Okay, so now that I have the back uncovered, I'm gonna listen to those lungs. Again, same thing, breathe in, breathe out, and I'm gonna do in 6 seconds. Perfect, both lungs are clear. No abnormal sounds. And now I'm gonna spread the buttocks. I'm so sorry, Miss Sandra. I just need to check and see if you have any hemorrhoids coming out, but I don't see any hemorrhoids coming out. I don't see any lacerations in the perineum area, which is great, and I don't see any bleeding or any abnormal coloration in the skin. So now my patient tech is helping me to bring the patient back to supine position, semi-fowler. Okay. All right, perfect. Okay, so this patient had a normal, she gave a normal vaginal birth, so she doesn't have any surgical lacerations, so I don't need to check for those. But I'm gonna be checking for Homan's sign. This patient is not at risk for any vein thrombosis. So Miss Sandra, what I'm gonna do is I'm gonna grab your leg and your foot, I'm gonna lift it up, and you're gonna tell me if you feel any pain in your calf, okay? So 1, 2, and 3. No pain, perfect. Okay, I'm gonna be doing the same in your other leg. 1, 2, and 3. No pain, all right, perfect. Okay. Since I'm here, I'm going to be checking for pedal pulses. Both are present and normal. Very good. So I'm going to bottom your blanket, your back. And now, lift this up again. Same on the other side. I'm gonna bring the chair down. Hello, Mr. Carter. Okay, Miss Sandra. Before I conclude my assessment, I would like to know how are you feeling? How are your emotions? You're very happy because you had a child. Okay, that's really good. So I'm gonna leave it here. I'm gonna take off my gloves, put it in the trash. I'm gonna use some hand sanitizer again. Miss Sandra, here's the call emergency button. If you need me, please give me a call as soon as you need anything, okay? Now that I have the bed down, the patient is safe, then I'm gonna wash my hands before I leave. That's it.